The gym is a place for everyone. It's a place for people of all sizes, shape, background, gender, and of course, ages. Or is it? Can a 10-year-old child lift weights? Will that stunt their growth? The truth is, it probably doesn't. In this video, we will be breaking down strength training. We'll tell you exactly what it is, how it can affect your physical and mental health, as well as debunk the myths associated with it. What is strength training? Strength training, or resistance training, is not just weightlifting, and it includes all strength and endurance exercises. There are multiple categories of this training. These include weightlifting, where you lift weights like barbells or dumbbells, like doing a bench press or bicep curls. Bodyweight exercises, where you use the weight of your body to work out, like push-ups and sit-ups. Isometric exercises, which are exercises where you squeeze your muscles but are totally still, like planks and wall sits. And plyometric exercises, which helps train your jump, like box jumps. What does this myth mean, and where did it originate from? Well, this myth that weightlifting stunts your growth could have many origins. One possibly being the fact that it stems from the idea where bodybuilding at a young age is not recommended because it puts too much strain on the muscles, tendons, and something called growth plates. Bodybuilding is using strength training, like lifting heavier and heavier weights, to progressively grow muscles. Growth plates, or epiphyseal plates, are a plate of cartilage on each end of a long bone. Take this femur for example. The femur is the longest bone in your body, located in your upper leg. It has growth plates on each end. These plates of cartilage are actually made up of cartilage cells, called chondrocytes, and they grow and divide in order to grow the growth plate outwards, away from the middle of the bone. As the older chondrocytes die, osteoblasts, which are bone cells that make new bone, come and turn the dead chondrocytes into bone. As boys and girls go through puberty, increasing in levels of estrogen will lead to an increased amount of chondrocytes dying and being turned into bone. Eventually, all the chondrocytes that make the cartilage of the growth plates become bone, and finally the person stops growing. Children who weightlift without proper technique or supervision from a qualified trainer may use excessive load and improper form, which can increase their chance of injury.
However, although this type of injury may sound scary to some, the rate of injury among children and adolescents who weightlift is relatively low. According to a study by Hamill, the rate of injury among 11 to 18-year-olds who weightlift was much lower compared to sports such as soccer and rugby. In fact, most of the injuries that do occur during weightlifting tend to be preventable with proper coaching, supervision, and programming.
Many major global health authorities, such as those listed here, still deem weightlifting as safe and effective.
A type of injury associated with this is called the epiphyseal fracture, where the bone separates at the growth plate. This can cause early closure of the growth plate and stop the growing of bones at this region. So, while yes, bodybuilding at a young age can lead to injury, proper and light resistance or strength training, such as using light free weights, weight machine, and doing body weight and resistance exercises, is similar to any high-impact sport such as basketball, soccer, and football, and is generally safe, especially when children or youth are taught and use the correct form. In fact, the Mayo Clinic suggests that kids as young as 7 can do light strength training. Epiphyseal fractures do not only happen in bodybuilding, but also in any sport, such as football, skiing, biking, and even falling. So there will always be a certain risk when it comes to any type of exercise, including strength training. But if it is done right and using lighter, safer weights, then it can be actually quite beneficial.
With all of this in mind, what factors can actually prevent someone from achieving their maximum growth potential? Some common factors you may have heard of are vitamin D and calcium. Calcium is an important component of bone tissue and is necessary for bone growth. Similarly, vitamin D is needed to help the bones absorb calcium and use it to make them stronger. Without getting vitamin D and calcium through your diet, either through milk or supplements, this can really impact growth, especially in children and adolescents. Everyone, particularly children and teenagers, need to make sure they're getting enough sleep. As teenagers, it's easy to stay up late and still wake up in time for school the next day, but that doesn't mean you should. Constantly being deprived of sleep can result in damage to the growth plates found in your bones, which can prevent you from growing. What role does exercise play then? While it is true that overexerting your body physically can cause fractures and injury to the growth plates, this is something that applies to all exercises, not just weightlifting. Physical activity may even strengthen the bones and increase growth in adolescence. In fact, a lack of physical activity is said to prevent the bone from growing. As a result, contrary to the myth, exercises like weightlifting are important to ensure one's bone can grow how it should. Like any sort of physical activity, however, those who engage in weightlifting must make sure they do so at a manageable weight. This is especially true for teenagers who should consider lifting lower weights combined with a higher amount of repetitions. Now that we know weightlifting does not stunt growth, the question is, should you be lifting weights?
We are not experts, so we recommend that you talk to your doctor first and do your own research to see if it's right for you.
But if you feel that this is something you can incorporate into your lifestyle, physical activity can have many benefits on someone's mental health. For example, research has found that weightlifting decreased symptoms of depression, anxiety, and stress in adolescents. This is a finding that has been found not only in normal everyday life, but even held true during periods of isolation and extreme mental strain, such as the COVID-19 lockdowns in 2020. Youth weightlifting and resistance training is also known to improve one's cognition, as well as improve their self-worth, self-efficacy, and self-esteem. As a result, weightlifting in adolescence can result in teenagers and young adults who are smarter and more confident. Overall, it is clear to see that youth weightlifting can have many positive impacts on the mental health of those who engage in the activity.
Whether you are an athlete or not, weightlifting can be highly beneficial for you. Participation in weightlifting can not only increase your strength, but it can also increase other strength-related variables such as endurance. Change your body composition, which is the percentage of bone, muscle, and fat in your body. It can improve your overall motor control, as well as increase your bone mineral density. According to the National Institutes of Health, up to 90% of peak bone mass is acquired by age 18 in girls and age 20 in boys, which makes youth the best time for kids to invest in their bone health. Considering this, bones are similar to your muscles in how they get stronger the more you use them. Lifting weights can help to strengthen your bones or increase their density, which later down the line may possibly reduce your likeliness of developing bone disorders such as osteoporosis. Now, if you're an athlete, you know how disheartening a sports-related injury can be. One twist of the ankle and you could be out the entire season. In the US, it has been reported that about 3.5 million sports-related injuries in children under 15 years old will require a medical visit each year. However, the inclusion of weightlifting in an athlete's strength and conditioning program can be highly beneficial. In fact, a study by Cahill and Griffith on adolescent football players showed that after adding weight training into their pre-season conditioning program, there was actually a decrease in knee injuries and surgery over 4 competitive seasons. Additionally, another study by Heshna et al. Showed that the inclusion of resistance training also reduced the time it took for athletes to return to play post-injury. So for